翻到嚟知識 ESG 嘅時間，今日咧直播室裏面繼續都有 Christine 林淑敏喺度嘅。我哋今日咧好高興，繼續咧會訪問一啲咧獲得灣區企業可持續發展大獎2023嘅得獎企業啊。咁啊，介紹下我身邊呢一位嘉賓先啊。咁啊，今日咧我哋請嚟就係和黃醫藥企業管理與傳訊高級副總裁，咁就係李健雄先生嘅。Mark 你好 ，nice to meet you。
Nice to meet you。
係啦，今日咧阿 Mark 咧就會利用呢一個嘅英語咧就會作為呢個回答嘅。咁啊，當然啦就相信咧我諗好多位聽眾咧都會明白佢嘅簡單易明嘅英語啦嚇。咁啊，但係咧就我亦都會即係喺度咧就重點咧作出少少嘅 translation 嘅。咁啊，不如呢個時候咧先開始我哋今日嘅訪問啦嚇 ，Mark。咁啊，因為咧首先都要恭喜你哋啊 ，congratulations for the achievement for our GBA ESG Achievement Awards 2023啊。咁啊今次咧就阿 Mark 佢哋和黃醫藥咧就獲得咗即係呢個嘅灣區企業可持續發展大獎嘅4個獎項啦。咁啊都好想即係了解下咧，其實由 ESG 我哋通常咧即係睇呢一個嘅 ESG 嘅可持續發展報告嘅時候咧，都會睇到有一個矩陣圖，我哋成日都講噶啦嚇。喺呢個矩陣圖嚟講咧，當中有啲咩重點係佢哋最着重，又或者係個分佈係點啦 ？So Mark, what are the key points of the company's ESG matrix?
We've got 11 targets. We've established these targets late last year after we took several steps. We went through a full materiality assessment, which included, for example, a large survey of all of our employees, a survey of all of our stakeholders, our management team. That includes our suppliers, our the patients and hospitals that we've worked with. So as we went through all of that, we established through quite likely a lot of the items, because we are in fact an innovative pharmaceutical company. We're very focused on the health of everybody, the health of individuals, in what we've been working on. So it comes as no surprise as the number one item for all of us, whether inside the company or outside the company, was ethics. When it comes to the healthcare of our people, our patients, how we conduct our science, why we conduct our science, and find innovative new medicines for these diseases that have nothing for them, we very focused on something like the priority was business ethics. Beyond that, of course, access to healthcare and innovation. There are companies out there that are more focused on bringing what healthcare is available to people already and just trying to accelerate that. But that's not actually our focus. Our focus has been on new things. So our company's been around for over 20 years. We've been engaged in very new age research and development, research right from looking at the disease. In our case, it's cancer. We're very focused on cancer. So we want to bring innovations to people to extend those lives that otherwise have nothing available to them. And that's what we call unmet medical needs. And so having an innovation to progress and extend those lives where it doesn't exist is what we're focused on. An example is one molecule, one drug that we are hoping to have approved in the United States very soon is one for colorectal cancer, for patients who have already taken other drugs that doesn't work, chemotherapy no longer works for. So that's another one. Beyond that, of course, working with our team and working to improve our environmental footprint, our social impact. We work very closely with the community. In our case, particularly on the commercial side and the medical affairs side, we work with hospitals, institutions all over China to see what is needed and to bring that healthcare forward. I talked about access to healthcare. We've now got all of our drugs that are currently on the market in China. We push as hard as we can to get it on the national reimbursement list, to reduce the cost to patients substantially, so that we can give not just a few thousand people access, but tens of thousands of people or hundreds of thousands of people access to our drugs. And that's so that a lot of that was put together through the work we did last year in terms of materiality. And then as we moved on, we built that into targets. There are targets related to E, S, and G, environmental, social, and governance. And we have 2 or 3 targets for each of those.
係啦，嗱喺度都即係講少少講解啦嚇，因為咧即係啱啱都有提到咧，其實即係喺2022年嘅時候咧，佢哋都開始做一個咧好重要嘅議題一個評估啊嚇，咁亦都咧即係喺內部啦同埋外部方面咧都有一啲嘅即係持份者去參與嘅，咁特別咧就有喺4個階段咧有一個嘅重要嘅評估性，咁第一咧就係呢一個議題嘅識別啦，第二咧就係呢一個持份者嘅參與同埋呢個參與方式啦嚇，咁另外咧仲有一個優先排序以及咧評估同埋確認嘅，但係咧都有講到咧，即係其實喺個ESG 裏面啦，咁當然啦就佢哋嘅即係和黃醫藥啦，咁當然啦就係以同健康咧係好有關係啦嚇，咁亦都咧即係好着重呢一方面，特別咧就係即係喺呢一個 cancer， 即係喺呢一個嘅癌症嗰方面咧，咁佢都即係着墨都幾多嘅。咁另外咧就講到另一樣嘢咧，就係創新嚇，即係 innovation。咁講到創新方面啦，當然咧就佢哋會有個 course 嘅，咁但係個 course 就希望即係可以減低到咧好多嘅即係例如係患者嘅一啲嘅 cost 咧，令到更多人咧去受惠。咁我諗呢個咧係佢最着重嘅一樣嘢。不過咧，仲有少少時間咧，都好想問阿 Mark 咧，即係多一個議題嘅嚇。咁就係關於咧，就係佢哋喺呢個 ESG 嘅層面上面啊，其實咧嗰個嘅執行嘅方案同埋成效係點樣嘅咧嚇？So Mark, can you introduce the company's actual implementations plan, and how about the result of the strategies or your ESG strategies?
Yeah, so I think we've certainly now. I mean, first of all, I have to say that while we've been leading this ESG strategy just in the last few years, but our company, the people in our company are great. We've because it's founded by scientists and people looking to bring innovation to more people and bring healthcare to more people. It's been probably, I think, a bit easier for our team to work with the whole company, everyone in the company, to move these initiatives forward, because it's everything I've just said are things that people immediately understand and get, that these are things that we should be doing. So as part of that, for example, firstly on the environmental stuff, as I said, we have several targets, 11 targets. On the environmental targets, we are focused on improving our carbon intensity. What I mean by that is improving the reducing the CO2 we generate per dollar of revenue. And that's very difficult actually for us, because we are a growing company, we're an innovative company. We only launched these very new drugs in the last few years. So with these new drugs, so we've launched these, we've worked hard to transfer, we're building new factories, to reduce our carbon, keeping the carbon in mind. We have many targets for 2025. So between carbon, energy, and actually air travel, where we have varying degrees of reduction targets of maybe 30-40%, for depending on which one it is, to reduce. And then I mentioned before the initiatives in terms of the access to healthcare. You've already mentioned it. It's the need to get these drugs onto the reimbursement list, but not only that, but really briefing, we're very again, this is scientists working hard to do what scientists do, not just us, but we work hard to disclose everything that we innovate. All our innovations we publish as soon as we can in medical journals. That's I guess that's a social input, but in terms of targets, that again gets that science out to people. And then in terms of governance, we started from a very solid base. We were founded, if you will, by one of the most solid and well-governed companies here in Hong Kong. And so with that base, we've very solid governance in terms of how we make our decisions, why we make the decisions, making sure they are in line with best practices, and we've increased the amount of policies that we've disclosed. An example is for example, how we conduct our clinical trials. We actually conduct them in a very, very ethical manner with patient consent policies and the like, but these are things that we didn't always disclose. And so we've put a lot more of that out into the public domain for third parties to be able to assess how we conduct ourselves. And we have a 4-tier sort of sustainability management framework. So with the board, a sustainability committee within the board, a sustainability management team, and a much larger working group within the company, across the company. So with all of that, we've really tried to put all these initiatives and get them going as quickly as we could.
係啦，嗱都講翻少少啦嚇咁啊，頭先咧都有提到咧，其中一個即係好重要嘅咧，就係點樣減低嗰個碳足跡啊。咁啊，其實咧即係2022年咧，佢哋已經係減到咧去40% 啦。咁而家咧去到2025年咧，佢哋嘅目標咧就希望可以減到咧，即係將嗰個碳排放咧減到去30% 嘅。咁啊呢個咧就即係亦都係一個好好嘅一個目標啦嚇。咁啊另外咧，亦都即係有睇翻啦，即係都有睇翻佢哋嗰個嘅即係可持續發展報告啦，咁啊都有即係為呢一個嘅11項嘅即係一啲目標咧，去制定一啲中短長期嘅一啲目標嘅，咁啊亦都咧就涵蓋翻呢個 ESG 嗰個領域啦，咁亦都咧即係佢哋有提到咧就採用呢一個嘅 SMART 嘅方法啦，即係 SMART 嗰個方法咧佢設定一啲目標嘅同時咧，亦都係檢視到咧就係嚟緊嗰個趨勢啦、指標啦同埋呢個目標嘅。咁啊，另外咧就關於呢一個嘅管治架構方面啦，咁其實我見到咧即係嗰個嘅架構咧都幾分明下嘅。例如咧就有董事會層面啦，咁啊亦都咧就係即係有呢一個嘅可持續發展委員會啦，再加埋咧就有呢一個高級嘅管理人員啦，以及係可持續發展工作小組等等啦。咁啊呢一層一層嗰個工作嘅層面咧都幾分明一下。咁另外咧，亦都即係再講翻啦，咁佢哋咧即係作為一間咁創新嘅公司咧，其實即係喺好早之前咧，即係較早之前咧，已經係有3隻嘅抗癌藥，因為頭先都講過啦，即係喺呢一個嘅cancer 嗰方面咧，佢哋係特別着重嘅，咁所以咧即係喺3隻抗癌藥裏面咧，都已經係喺呢一個嘅內地嗰度咧，就惠及咗一啲嘅患者㗎啦。咁嚟緊咧，亦都會係即係將另外一啲嘅抗癌藥咧，希望咧可以申請係獲批到係全世界咧都可以用得着啦嚇，咁呢個咧都可以即係睇到咧佢哋對於咧係喺呢一個嘅社會咧，尤其是人嘅健康方面咧嗰個着墨點喺度。不過咧即係都好想繼續去睇下，其實點解即係作為一間嘅咁創新嘅公司，佢哋會咁着重 ESG 嘅咧嚇？到底即係嗰個嘅 impact 喺邊度咧 ？So Mark as Hutchmed and very innovative company. So why ESG is so important to the company, and what are the impacts of ESG as at the corporate level?
Right. Yeah. I mean, it's been a journey for us. We've been, as you said, we're a very innovative company based here, but it really is a combination of the listings that we've had, the shareholders that we have, the both public and private investors, the corporate partners that we have. And our desire to move ahead with the regulations of for example the Hong Kong Stock Exchange. So for example, we are triple listed. We're one of the few companies in the world that are listed not just in 1 or 2 places, but actually in 3 major exchanges. So we have primary listings with the London Stock Exchange to begin with. Then we had a primary listing on NASDAQ. Back in 2016, and then more recently, a few years ago, we listed here in Hong Kong on Hong Kong Stock Exchange. We're a Hong Kong company, of course, but until more in the last few years, the ability for an innovative biopharmaceutical company like ours made it harder for us to list, which is why we listed in those overseas jurisdictions first. Now, because we have that unique combination of shareholders, we have European investors and American investors and Asian investors as well. And depending on who these are, they have various goals on, and I've asked many questions over the years on what we are doing about climate change, about social governance, and in fact, corporate governance. So those kinds of questions where we've got large, very well-known shareholders that we've all heard of from the UK, for example, have been very relevant in those conversations and help push us to look at these areas. Another aspect is the corporate partners that we have. We are partnered with some very, very large and very well-regarded multinational pharmaceutical companies that work around the world and also strive, as we do, to improve our sustainability footprint. We have partners like AstraZeneca, which is the global pharmaceutical company based out of the UK, like Eli Lilly, based in Indianapolis in the United States, and like Takeda, which is the global pharmaceutical company based in Japan. So working with those partners, the work that we do in developing these new drugs that we have, that these are all drugs that we have discovered in our labs and started developing them, and then these partners came in and thought, yes, we want to work with you, develop these drugs, and bring ultimately these drug products to patients around the world, which we couldn't do by ourselves. And as we work with those, yes, of course, they are also very focused on improving the sustainability, as I said earlier. With those three listings as well. I mean, most recently with the Hong Kong Stock Exchange, for example, I think the Hong Kong Stock Exchange is taking some very forward steps ahead of other jurisdictions like the U.S. jurisdictions, for example, to bring in and require a greater level of transparency. The HKEX has been focusing, for example, on ISSB, these new International Sustainability Standards Board. It's a fantastic, a great deal of work done by them, done by the board, to try and bring in all the various considerations. What is ultimately best practice and best disclosure for sustainability? I mean, and I think those are coming in. Those will be implemented and be required over the next few years by HKEX. But we ourselves, actually, we've been doing that for some time. For example, there's TCFD, the Task Force for Climate-Related Financial Disclosure. These are the set of requirements on improving and disclosing and showing that the company has considered the environmental risk, the transitional risks, for example, of a future where there is climate risk in this world. And we've just as of last year, 3 years ahead of what was required under TCFD terms, we've moved ahead and put a lot more disclosure into our reporting to get ahead of the curve, get ahead of everybody, and show that we are very focused on this area.
係啦，咁都同大家去講一下啦嚇。咁頭先阿 Mark 都提到咧，因為大家都知道啦，嗱其實佢哋自己最近咧咁就係喺香港嗰度港交所度上市啦。但係其實之前咧咁已經喺呢一個嘅倫敦啦同埋紐約嗰度咧都已經係上市啦。咁喺三大嘅唔同嘅咁大嘅地區裏面咧上市嘅話咧，其實都要符合當地嘅一啲要求，咁亦都咧係要符合一啲嘅投資者嘅期望。咁例如係一啲嘅譬如有一啲英國一啲好大嘅投資者或者係基金公司等等。咁如果咧佢哋係要了解一間公司嘅話咧，原來咧都對於佢哋嘅 ESG 咧都幾着重嘅。咁再加埋咧亦都有同一啲合作伙伴啦嚇。咁我哋成日都話咧，大手扣小手。咁原來咧和黃一間咁大嘅一間 company 咧，其實佢哋都要同其他嘅一啲藥廠咧去合作嘅時候咧，原來其他嘅藥廠咧都係好着重呢一個嘅 ESG 嗰個層面，一啲可持續嘅層面嘅嗰個嘅層面啦，睇下有冇大家一啲嘅合作機會。原來呢個咧都係擺得幾前頭。咁無論係英 英國嘅藥廠啦、美國藥廠甚至係日本嘅藥廠啦，對於呢一方面咧個要求都好高。咁幸好嚇，即係和黃醫藥咧，其實都做得幾足同埋做得幾前嘅嚇，因為咧即係雖然咧係喺呢一個港交所個要求咧，就我諗最近大家都睇到個新聞啦，就話即係根據呢個 TCFD 嘅時候咧，希望去到2025年嘅時候咧，其實啲上市公司咧都要即係做一啲嘅氣候信息披露。咁但係原來咧和黃咧就唔單止佢哋本身咧就因為即係喺呢一個嘅創新方面咧行得前啦，原來佢哋嘅行動喺 ESG 方面咧都行得好前嘅嚇。佢喺早過喺2025年咧，即係早3年前，我諗即係喺2022年，你識 2022 to do the
yes
係就已經係做咗呢個TCFD 嗰個嘅氣候信息披露㗎啦。咁所以咧就即係唔使講。就已經做咗嘅時候咧，咁我諗咧，即係足以係見到其實佢哋本身一間嘅創新公司啦，咁其實都已經咧喺個思維上面好創新啦，並且咧就已經喺呢一個嘅可持續發展上面嘅框架下咧，就已經係有呢一個創新思維㗎啦嚇。咁啊，所以咧即係今次咧獲得呢個灣區企業可持續發展大獎2023咧，亦即係實至名歸啊！咁啊，再次恭喜阿媽你哋嘅即係和黃醫藥啦，咁啊獲得呢一個灣區企業可持續發展大獎，期待咧出年再同你哋咧做訪問，咁啊希望咧出年再見你哋啊！今日咧節目時間差唔多，唔該晒阿媽嘅 ，thank you Mark。
Thank you for having us.